Yeah, so then our next section is about fear-free, which is a really exciting thing. It's something that our entire company has decided to jump in on. Lindsay, have you done any of those little
Yeah, I'm registered for
educational?
fear-free. I have yet to start doing some of the modules, but yeah, I think that just today's segment sort of made me like, it was a kickstart for me to get on and start doing it. Hi
Yeah,
there.
yeah. No, I've done two of the segments so far. I mean, they're dense, they're not, you have to sit and really watch it compared to some of the other CE that you can kind of just listen to. But um, it's definitely very interesting. It's something I'm very excited to get started with.
Yeah.
So we have also from Wheat Ridge, Brooke Duran, can you introduce yourself, Brooke?
Sure. I am one of the hospital services managers here at Wheat Ridge Animal Hospital in Colorado. And I am also a certified technician. I split managing the clinical departments with the person who preceded me on podcast, Trisha Keohana. I always mispronounce her name. So I won't list all of my teams, but all of the specialties and GP kind of fall under me, with the exception of blood bank, ER, ICU, surgery, and patient care. She does those. So every other ology is under my realm.
Yeah. And Wheat Ridge is very much like a sister, very much a sister hospital for us, because they are the only other hospital within our network that does have that interesting combination of services that does include GP. We both have physical therapy departments. So they do very much what we do. And Fear Free is something that our entire hospital group, the entire Ethos network, has started to jump on. And I think Wheat Ridge is really far ahead in that, having started a lot of that before even the entire company did.
Yeah, we did. We were very lucky to have a corporate sponsor come in and help us with getting everyone paid and going through the training to be fear-free certified. So one of the interesting things that came up is a lot of the general practices are getting certified in fear-free. And we said, how do we extend this to include all of our specialists? Because you have to have a certain percentage of people to be a fear-free certified hospital, which is something we're very close to accomplishing. We're not quite there yet. So at this time, the majority of our team members are fear-free certified and have renewed their certification, which means that essentially they've just taken a series of courses, I think in total 4 hours, and educating them on the why behind moving toward fear-free, kind of giving them the anthropomorphic insight to the animal perspective that they might not have thought of before. And then how to execute minor things and major things that can make your hospital more fear-free oriented, which can have a really profound impact on the pet's experience and subsequently the client's experience. So the takeaway is twofold, which is really, really impactful.
Yeah, I mean, in fear-free in general, I feel like everybody or all clients would sort of assume that, going to the veterinary office, it should be fear-free. But in reality, it can be quite an a very scary event for these pets. And the fear-free concept really came out, not too long ago. I think it was like 2016. This was sort of started as an initiative to get veterinarians, technicians, receptionists, client care workers to get their certification in the fear-free to really help promote this better experience, if you will, for the veterinary patient.
Yeah.
So tell us about just the general idea of the fear-free program. What does it mean if someone goes to a hospital and there's a little sticker on the window that says fear-free certified, or they go and they search online and find a fear-free practitioner?
Sure. I think the crux of that would be that we are constantly in a self-aware mindset of what is the animal experiencing as they come in for these procedures, because there's rarely an occasion where they come in and there's not a needle involved. There are strangers, and one of the main components is understanding the differences in their biophysiology and how fear is triggered in them than from humans. So what it means for us is we've looked at what do cats need, what do dogs need. So, for example, the sense of smell in animals we know is exponentially more sensitive than in humans. So having a lingering smell of a certain chemical, or even of a dog, different pheromones that are involved, can have a really, really significant effect on the animal's experience. So fear-free is, we have tried to modify not only our environment, including just the sound, so incorporating all of the sensory options there. So auditory, are there barking dogs in the background where the cats are sitting? Was there a dog in the room before the cat enters? So we're basically proactively trying to preempt those negative experiences. And so our hospital, being fear-free thus far, is we have separated where dogs and cats go. We've tried to give cats a higher elevation of where they can be when they're here hospitalized, so they have that comfort of being up high, which is something that they naturally need if they were to be out in the wild fending for themselves. It also takes into account just the fact that we're strangers, and we're also comfortable with animals. We think, oh my gosh, it's a cute golden retriever puppy and everyone wants to touch and pet it. But if you kind of turn the lens around and look through the golden's eyes, there are 20 hands of strangers coming towards them. So to me, it's just a matter of shifting the perspective, and it aligns with the positive psychology that's been kind of changing over human medicine the past couple of decades too. And this is a little bit of an offshoot of that. And it's positive affirmation, just having the setting preset where you're mitigating the fearful experiences, keeping the staff members constantly aware of, fear is a huge component in visiting here, and giving the staff members the tools to counteract that fear. So that's sort of the overall sense of it. And if you were to sum it up, if I had to sum it up in one phrase, it's making this as much of a positive experience for your pet as it can be, despite the fact that we need diagnostics, we need samples, we need to give vaccines, we need to restrain and do all of these things that are unpleasant. I sort of think of it as analogous to, I took my 7-year-old to the dentist the other day for some extractions of crowded teeth, and same thing, for me, I'm an adult. I'm aware that it's going to be a little bit uncomfortable and painful. They don't really know what they're expecting. So it's, again, just putting yourself in those shoes and having that perspective and modifying what you can do in real time to help make it a better experience.
Mm-hmm. So it's very clear too that it's a benefit to, for sure, the practice to be able to do. I mean, how many times do we run into cases where we have an aggressive cat or we have an aggressive dog, and we need, I need blood work on this animal. And so then you're stuck with either holding this pet down and muzzling it, and just, it's so stressful. It makes you hot. I mean,
yes, it does. Yeah.
And it's traumatic for the owners too, although we try to shield them as much as we can from that. It's still the kind of thing that it really benefits. It seems like it benefits everyone.
It does. And I think that's an important facet is, we do still need to remove animals from their owners. A lot of times because my pets, for example, are way more nervous with me than without me. And it's pulling back that curtain and letting owners know what we're doing, what their pet is experiencing, and the measures we're taking to try to make it more comfortable. Because as you said, if you get a fractious cat or any cat, and we need those diagnostics, we need blood, we need urine, whatever it is. Once you start getting into the arena where they're already wound up, their cortisol and their adrenaline is kicking, even having to use chemical sedation, which is a big component of fear-free. And we'll touch on that in a second, because we need to get clients more comfortable with knowing that that's a very safe and effective way of being fear-free. So take away the negative connotation of sedation, and anesthesia, because those are actually positive things. But for us as practitioners, it's also beneficial because it helps us give the best medicine we can, because we're able to get those diagnostics and not say, hey, we're going to have to send you home and you're going to have to come back another day, and we're going to have to sedate quickly or beforehand or something like that.
Yeah. And I think the sedation too, and I know you want to touch on that, but that is a piece that is so important because often these veterinary patients do really respond to either some sort of oral medication beforehand, or if need be, like a quick injection when they come to the hospital. And it really does help simmer them. And I do feel as though there is sort of this negative connotation that's associated with my pet had to be sedated in order for the exam. That's not necessarily a bad thing all the time. There's some pets and patients that, regardless of any pheromones that we set and different rooms that we can set up for the cats versus dogs, or food rewards that we can give, there's some pets that just will not, relax in a normal setting without some sort of additional help.
Yeah. Yeah, and it is. There's a stigma associated with that still. And I think that also relates to, what does the word fear mean? We say, oh, your dog is being aggressive. Simply explaining your pet is being aggressive because they're afraid. Your pet is not a bad pet. We're recognizing that this is all stemming from fear rather than innate aggression that an animal may have. So educating the clients on our processes and the fear-free movement is one of the reasons we're doing this podcast, right? Because we need to let them know that it's not a stigma to have that. It's not a scarlet letter on your pet to say, all right, your pet needs to be sedated. All of my animals need to be sedated before they come in. And to me, that's great. They're going to get a sedative. They're going to be relaxed. They're never going to have wind up anxiety. Because that's something else too. There's both the biophysiological release of certain stress hormones, but they also have mental anxiety too, which humans, in my very ignorant non-DVM, knowledge of this, didn't recognize for many years in the past, and we have over the last couple of decades. So there's a mental component and a physical component, and we're trying to respond to both of those to make it a more pleasant experience and hopefully a positive one.
Yeah.
Did you find that, as you were rolling this out, did you have, I think one of the anxieties that some doctors have expressed is like, oh gosh, this is going to make it take so much longer to do everything. Yes. Did you run into any of that? And what's your take on that?
We did. So we got that, I would say, from 80% of our practitioners, mostly the doctors. And the way that we responded to that is, this is novel ground for all of us. So let's give it a try, be open-minded. And what we have found is working with our anesthesiologist and having some preset sedation protocols, especially using the certain oral medications that the owners can give at home beforehand. It's actually made the appointments faster. It's made the experience shorter for the pets. So we were able to quickly sort of show them that, when you take 2.5 extra minutes to give a sedative injectably, or to take those fear-free maneuvers where instead of scruffing a cat, you're wrapping them up in a towel and spraying with pheromones, it actually ended up, in the data we collected, saving probably 8 minutes per visit. So once we were able to show them that scientific data, they were on board with it. And we also correlated this with less bite incidents. So that was an interesting factor. So we did a report of, pre-fear-free bite reports and post-fear-free bite reports. So there was a definite reduction in there.
That's great. I mean, I don't know about you, Krista, but I feel as though, even though I'm not, since it's relatively new, I'm not fear-free certified yet. For years, I feel like if I look at a super anxious dog when I go into the room that's just not going to be amenable to a physical exam, I found that I would always go to try to just sedate them beforehand to really try to make the experience better for everybody involved. And whether or not that was, he's really worked up today, I can see it. Let's try this oral medication next time and have you come back in. Yeah. Or let's see if we can try a quick injectable and see if that can just simmer them down. And then in the in-between time, you can see another patient while that medication is working. And it really does make for a better experience for everyone. And you get a better exam. You can look at the patient much more thorough. And the owners are feeling, I think, in general, even though at first hearing that word sedation, once they see that pet calm and relaxed, and then they wake up and they're calm and relaxed, it's just a better experience for everybody.
Yeah.
Yeah, I don't know. I never really jumped to sedation very often. And so it's going to be a newer thing for me, but I'm not opposed to it at all. I think I just tend to either get less great of an exam and just try to not push that pet past its limits, or, just kind of do something really quick and get out, and that's not really always the best. I think yesterday I had this dog that was like terrified. And how do you feel like owners? I feel like the majority of owners really would love this. And then occasionally you get those owners that like persist in asking for the thing that this pet is going to freak out about. Yesterday, I could think of this one pet that I was like, it's terrified out of its gourd, but gosh, we got to get its nails done.
Right.
And like, so this owner was not prepped at all for any sedation. I actually sent them home with some sedation and said, the next time, this is what you're going to do ahead of time, because he's terrified. And it isn't helping us to do this nail trim each time your pet comes into the hospital. Now we make this the worst experience of its entire life because it's having its nails done.
Yes.
And this thing, this dog is like, we tried our absolute best, but you have to muzzle it and you have to kind of hold it and restrain it. And the owner doesn't see any of that because right now we're doing a lot of curbside stuff. But like, do you still have owners that just say like, no, get it done? And do you resist that, or do you just kind of go back to the old way for those pets?
We do have that. And we have been resisting it. And so we've gone in and said, this is too stressful for your patient or for your pet, for the patient. And it's also putting our staff at risk. And so for those two reasons, if you want us to accomplish this service, we're going to need you to agree to take a different approach. And that would usually start with the oral sedation next time. And what we'll do in those scenarios that's been very helpful too is explain that at this point, even the visual of the clippers, the sound of the clippers is such a heightened trigger for this pet. We've got to work 10 times as hard to dial back from that. So we'll say, what we're going to do is basically give them a little bit of a dissociative sedation this time so that we can get the service done. And that the way they don't have any sort of memory of the experience. And then we say, we'll slowly try to titrate that down to less and less each time. And then we can incorporate those rewards, those positive correlations with the service. And we have had success with that and letting them know that, yes, we need to be, a little bit more medically aggressive with the chemical sedation this time. But our hope is that that's not always the case. And our staff is trained to slowly advance to the point where we can do this with just a pill, or we can do it outside, or, whatever's required. And usually if there's some sort of hope that we can get it to a less profound experience, then we're successful. Every once in a while we're not, and we do simply reserve that, we just send that person away and say, we refuse this service because it doesn't align with our fear-free protocol.
And we're talking about like the super worked up patients right now, the ones that are extremely fearful, but in reality too, we have to also focus on the puppies and kitties when they come in, as best we can, giving that a fear-free experience so they don't sort of get that underlying fear of the veterinarian. So lots of feedings while you're doing vaccinations. A lot of positive reinforcements you can do at a younger age can also kind of help in the long term.
Absolutely. And I think that's key is, especially starting with that blank slate that you have of puppy and kitten, to do that. An important note on that, as our dermatologist would be very reluctant if I did not mention this, is in using those positive reinforcements, we do have to be aware of food allergies and the potential repercussions in the GI tract that overtreating may have, which we've seen. So we have different levels of treats involved too. So we have high motivating, sort of the higher fat, higher flavor treats, and the ones that are a little bit less disruptive to their normal diet too, because one of the negatives that might be a latent negative is that you give this dog lots of hot dogs and then they develop severe gastroenteritis later. And I don't know if the dog would correlate that with the visit, but the owner certainly does. And then we've completely, failed in teaching the owner the benefit of fear-free. So there's a lot of little nuances like that the courses teach you that you maybe wouldn't have thought of, right? Because how many owners might call and tell us that that's happening?
Right. Yeah.
20%. So we have to be very aware of that too.
And to find a fear-free clinic, and there's like, the difference between the fear-free practitioner or somebody that's been registered a technician versus a fear-free clinic, it's actually pretty easy. Like I actually went online today just to see if I could find it. And, the website actually is very, easy to navigate, and you can just type a zip code in. You're looking for a practice within like a whatever mile radius, and it tells you everybody that's been certified. So they do a really good job at sort of keeping track of all that stuff.
Yeah, they do. Yeah.
So fear-free, we touched upon this a little bit, fear-free practitioner or technician versus a fear-free practice. There are pretty stringent requirements associated with becoming a fear-free practice. Can you touch upon that?
Yes. I think the big difference comes down to, you can have a practitioner or technician who's fear-free certified and knows how to do all of the things we've mentioned before now of making it a positive experience. The hospital itself being fear-free comes down to a certain percentage of those practitioners being certified. So regardless of who you're encountering, especially in a multi-discipline practice as we have with ER and general practice and other specialties, you don't know what service they're going to come in on. So to say that we're a fear-free hospital means that you might be dealing with a fear-free certified technician and doctor on your general practice visit. But when you come in through ER or see a specialist, you also are guaranteed to have that same experience and certification. And the larger picture of a fear-free certified hospital to me is the environment, the physical environment set up to accommodate the fear-free parameters, which involves separate physical space and keeping those olfactory stimuli completely mitigated as much as you can between dogs and cats. And one of the analogies I use with clients is I have this purple rug in my daughter's room that my beagle has urinated on several times, and I washed it on the sanitation cycle in my washing machine. And she still goes and pees on that exact same spot. And the reason is because she can still smell the urine in there, even after, I smell it. To me, it smells great. It smells fresh, clean, like the detergent that I used or whatever. And so having the physical space to separate that out and being stringent on, this is truly a cat ward. No dogs allowed in here ever. Well, what about for 15 minutes? No, because the cats, when they come in, they will still smell that there was a dog in there, and that can trigger a prey predator fear response in them. So a lot of what we still need to do here is make a few modifications to the physical hospital itself.
So, one thing that I wanted to direct owners to go take a look at is there is a owner-directed portion of the Fear-Free website called Fear-Free Happy Homes. And that's something that whether or not the hospital that you go to has Fear-Free or not, you can still check it out. And they have webinars for clients. They have little videos about training. And it's something that really just provides you with enrichment ideas for even home. It has nothing to do with even being at the veterinary hospital, but your pet might experience fear throughout its life that you're kind of classifying as, being bad or,
Yes,
aggressive. And you can definitely start to speak your pet's language a little bit more by kind of looking at those cues. And they have, that is an excellent website.
Yeah. They did
Yeah.
really
Yeah, I've just glanced at that. I've directed more people to it than I've actually explored it myself.
Yeah, me too.
I've learned a lot of this from working with an certified DBM animal behaviorist, and their focus is all positive reinforcement, right? But that's very key, Krista, because a lot of the fear can be perpetual at home. So they can be in a chronic state of anxiety and fear, and you don't even know about it. And that could be, does the cat who gets along with the dog not have a hiding place when the dog gets too crazy, or when you have other people home, things like that? Do they have enrichment if they're indoor animals? Do they get out enough exercise and all that? And pre-vet visit, I believe the learning that you're referencing also discusses this. So the fear can start with little things like when you put the cat carrier out, and when you pick up your keys, and all these tiny things that we do at home that we do routinely, animals pick up on. And so they often, and people will say, my pet knows when we're going to the vet. Well, yes, they actually do, because you go through the same routine and steps every time you take them to the vet. So the anxiety reel begins at home too. And so there's a lot of things owners can do to just make tiny modifications to prevent that as well.
Yeah. Well, that's excellent. So, we are all very much looking forward to doing these courses. We have about a third of our staff, I think, signed up already to do it. Yeah. And it probably will take a long time for us to get the entire hospital certified, because as you said, like, the rules are, for example, if you're a specialty hospital, you have to have at least 50% of your specialist in that department certified. So like, if we have a department that has one specialist, that one specialist has to be certified regardless of how busy they are, because they're our only surgeon. Yeah. So we'll see about the entire hospital. We have so many receptionists interested in doing it, and technicians, and that's really key, that people are sprinkled throughout the entire hospital and learn these techniques.
Yeah, it's exciting. It's really exciting though. I like it. And I feel like it just sort of is going to enhance that experience, that pet and that owner. And that's exactly what we want to do.
Yeah. Yep.
All right. Well, thank you so much, Brooke, for joining us. And
you're welcome.
So thank you to Ethos, of course, for always sponsoring this podcast.
Sure.
Check us out on any of the podcast listening platforms that you go to. So Google Play or the Apple Podcast Store. Is that right? Yeah. Okay. Rate us and review us. I'm Christopher Nolikin.
I'm Lindsay Renzullo. Thank you so much for joining. We'll see you guys next time.
I'm Brooke Doran. Thanks for including me, ladies. Have a good one.
Thank you so much for coming.
Sure.